Hi, Cheryl. How are you? Uh-oh. You've gone away.
I always forget to unmute myself. I'm doing good. How are you?
I'm well. It's good to see you.
Good to see you too. Even if it's just through a screen.
I know. Isn't it funny?
It's just going to be so exciting when we can just finally gather again. It's amazing how
There.
much that.
Yeah. I think it's going to be hard for
Yeah,
me. It's like,
yeah.
oh, wow. You're not cats.
Yeah.
So I think I'm already recording, so I don't want to say too much and spoil the surprise.
Oh, okay.
But I think we are going to have two new board members joining us tonight, which is
How
amazing.
exciting.
Yeah.
That's great.
So with luck, that will happen.
Excellent.
All right, I'm going to mute myself lest I say anything regrettable. Thank you for getting that started, Cheryl. This is for folks who are not board members or staff to go ahead and sign in the chat. We really appreciate that. It makes it a lot easier to know who was really here and how to spell their name. Hi, Kayla.
Hello, how's it going, everybody?
Good.
Good. It's almost Thursday.
It's almost Thursday.
Never thought that would happen.
I'm just glad it's raining and not snowing. So
Yeah.
Hi, everybody. Thank you for joining us, and please sign into the chat if you're not staff or board member of the mental health board. And I feel like this is a special crowd. This is people from the other end of the alphabet. You know, this is the the patient people. Joe,
Hey,
guess
what's
what?
up?
Because you have one of the two new board members here, you have a quorum
All
already.
right, all right. That's the way. That's the way to
We
go.
can- I know, this is it's so much
Yes.
easier. We could
Yeah,
still wait a
yeah.
minute and see.
We got a minute. We got a minute.
All right.
Because also, I think that if we're going to return to the one that we missed from last week, we probably have to wait a little bit. Is Julian? Because I don't see Julian or Susan on yet.
Susan's here.
Oh, okay, cool.
And I can talk about it if Jillian's not here.
Sounds great. He said that he'll be back from Texas, or maybe he was held up in Texas. Texas Hold'em. Really bad joke.
A pun.
I'm kind of excited to actually have a Zoom today. Our family is all on quarantine, so I'm kind of getting tired of seeing the other 4 people in my house. At least I feel like I'm seeing other people now.
I hear you. That quarantine is hard. We had to do that during the holidays between Christmas and New Year, and oh, it was hard.
The kids and I are on it through the 11th. Tony, who has COVID, is released to go back to work on the 5th. I'm like, how is that fair? And I've had 2 shots. But I didn't have my 2 weeks under my belt when he got diagnosed. So getting a lot of farm work done, I guess.
Yeah,
I'm sorry, Jane.
Really?
yeah.
Here comes Julian.
Okay, cool.
So I think we have a really nice crowd tonight. Like not just like high numbers, but like really great people in the meeting. So, and here comes the other new board member. So you really
Okay, well, you're ready to go.
good, Joe. All right, I'll be quiet. Oh, just for the record, Joe, I'm at the Brookins Administrative Building, which is the place for our regular meetings. There's Dr.
Mhm.
I was unable to get into the Lyle Shields room today. It's been locked.
Okay,
I kept an eye on it though. I went down a few minutes ago and there was no one there to get.
no one waiting.
I'm in my office. All right, thank you.
Okay. So we'll go ahead and get started. Let's do call to order. So roll call, please. Stephanie? It's okay. Well, you could just go by first names for this for now.
Okay. Susan Fowler,
Here.
Matthew Hausman.
Here.
Matthew, did I say your name correctly?
That's great. And you can call me Matt. That's fine.
Matt. Okay. Daphne Maurer. Elaine Palencia,
Here.
Kyle Patterson, Julian Rappaport,
Here.
Jane Sprandel,
Here.
John Paul Joachim,
Here.
Joe Omo Osagie.
Here. Okay. So do we do citizen input on this one, or we just go right ahead?
I'll put the agenda up on the screen because I can't remember, Joe, but I think it's different from how the DD board does it. You're right, citizen input first.
Okay. We'll give a minute for that if anybody's around wants to have any input. Okay, we'll move on to the approval of the agenda. Anybody move to approve the agenda?
I so move. Susan?
Second.
All in favor?
Aye.
Aye.
I think we have to do a roll call,
Oh,
unfortunately.
we do. Oh, okay. Yes, wanted to move on. Thanks, Stephanie.
Matthew Hausman,
Yes.
Elaine Palencia,
Yes.
Julian Rappaport,
Yes.
Jane Sprandel,
Yes.
John Paul Joachim,
Yes.
Susan Fowler,
Yes.
Joe Omo Osagie.
Yes. Okay. Instead
Stephanie,
of doing,
Kyle Patterson is here.
okay, cool.
Kyle
Cool. Instead of doing any comments, I mean, I would like to have the two new board members introduce themselves and tell us a little bit about themselves, okay? If that's okay. Matthew, will you start out, please?
Sure. Thank you much. Glad to be here. My name is Matt Hausman. I am a Champaign County native, although I moved away for a long time and just moved back to the area a couple of years ago. I'm currently working nonprofit. I'm the executive director of an organization called Feeding Our Kids. Professionally, I had a few different careers. And one more related to mental health is I was a high school teacher in LA for 4 years and dealt with a lot of behavioral, developmental, and mental health issues in that role. But more than that, my connection with mental health is more on a personal level, dealing with mental health issues, both myself, family, friends, and being well aware of the stigma with mental health concerns. And so that's why I wanted to get involved with the Mental Health Board, and looking forward to working with all of you.
Thank you very much. Thank you. So Dr. Daphne Maurer.
I see her here and I think she has called in, but I can't hear her. So I wonder if oh, there you are. Okay.
Hi, can you hear me now?
Yes, yes, we can.
Okay. Can you still hear me?
Yes, we can.
Yes.
Okay, all right, cool. Hi, I'm Daphne Maurer. I'm a psychiatrist. I apologize, I don't have my video up because I'm still at work and we don't have webcams on our computers because I work at the Correctional Center at Logan. I have been a psychiatrist since 2005 and worked at the Coles County Mental Health Center for 6 years, and then worked at Carl for a couple or 3 years, and then worked at Illinois State University and am now here at the Logan Correctional Center. And have just seen a wide array of mental health disparities and frustrations with getting access for patients. And so that was my primary reason for wanting to try to help out. I'm from a small town in Edgar County, but have lived in Champaign since 2005.
Thank you. Thank you. Thank you for introducing yourselves. It'll be great to work with both of you, and you'll get to meet the board as we go along and get to introduce ourselves or hear about each other as we move along. Thank you very much. Lynn, would you like to add anything for your comments for today?
Well, I would, but I'm so tired of hearing myself talk. I think I should probably put links to this, the agenda for this meeting, and also the packet from last week's meeting, since you're still using those materials, just in case anybody doesn't have those. And I'll try to follow along and keep relevant pieces on the screen as possible. I do want to share that I made a surprise appearance at the county board finance committee. Was it a committee of the whole meeting, Kyle? I'm not even sure, but
I mean, it's all made up, right?
I had some kind of county board thing or another, and just did a very brief public input, because they're wrestling with all the problems of sudden prosperity, and we could sure use some money. So I had a couple of ideas that I had presented to them in a letter. I'll share that with you all later, but also just wanted to comment to them that there are some really large scale things they could do with the money that our service and support system in this community would be probably really ready to do, like big permanent supportive housing. So that's really, it was a very interesting discussion. Thoughts and prayers to the county board as they become the grantor of $41 million, because it's hard enough to do $4.5 million, right? Anyway, that's my update. Thanks. I'm sorry.
Thank you very much. Thank you very much. Thinking that we can just right now go ahead and dive into it, Stephanie, since we don't have a new approval or anything like that.
So should I start with the refugee?
No, I think we have to go back to the Boys and Girls Club, CUNC, because Julian and Susan were not available for that last week.
Is it page 94 possibly?
Yes, 94 to 99.
Okay, I'm going to put it on the screen just in case that's helpful. Okay, here you go.
Okay.
Are you ready for me to say something?
Yes, go ahead, please.
Okay. Sorry, I was out of town last week, and so I'm slightly disoriented still. But this is a program that is a part of the programs that we asked the Don Moyer Boys and Girls Club to administer as a part of what we developed in our system of care for youth. They've been doing this stuff for a while, and I think they're asking for the same amount of money that they have had in most recent past, maybe forever. Actually, I'm not sure for how far back that goes. Lynn could say, but what it is aimed at young adults, family members, parents of young children, attempt to strengthen families and try to have them attend to things like using a trauma way of looking at problems and helping the families to make good decisions. And so it's essentially a family training and youth-oriented program. It served, if I can follow this, I think they say that they served 96 people in the past year, individuals. And I don't see any significant changes from what they have been doing. So I actually don't have a ton of things to say. There are some questions that the staff maybe wants to discuss, because I think some of the reporting is not necessarily totally clear with respect to what. I'm going to ask Lynn to comment on that, please, what the staff's view of the current system functioning is here with respect to any kind of contractual arrangements that need to be attended to, and so on. But programmatically, it looks like a continuation of what they've been doing and what they've been doing fairly adequately over the last few years.
Thank you. Yeah, it's a slightly lower request than last year, but last year was higher than previous years. I think
God,
that,
I'm really confused when there's a slightly lower request. Okay.
yeah, I think that it's just when a program is relying really heavily on subcontracts and volunteers, like we have provisions in all the contracts that we want to see. We want copies of the subcontracts if they are related to the services that are in the contract. So I think what these might not be, but we just want to make sure that if, in case they are, that we have copies of those agreements. Otherwise, I think that we get a lot out of this program, honestly. So.
Yeah, it's a long-standing, well-received program in the community.
This is Susan. I was the second reviewer on it, and it has been around for 5 or 6 years. It came out of the system of care, as you mentioned, the SAMHSA grant. At one point, it was called Champions, and it relied primarily on volunteers who provided peer-to-peer support. And it's moved into a more formalized system with workshops, but I still wasn't clear how much of the support provided was through peer-to-peer support and how many volunteers were involved. I know that we've been happy with the performance in the past couple of years, but I had trouble following exactly how much they were doing during the pandemic, virtually or in settings where there was some face-to-face contact. And I'm not recommending any reduction or to recommend against funding it, but I just thought it could have been a bit more precise in terms of what the services were. So we do know that they served 96 people, and that's great. But I don't know exactly how many workshops they had or how many volunteers they trained or things like that. And in the future, that would be helpful.
Thank you.
I wonder, I don't know if anybody's here from the program to speak to that, but we could just ask for more detail in the reports on through which pieces. Because I agree, Susan, it seems like a very complicated program. It'd be good to have some data to get our arms around it.
Yeah.
Well, it's complicated by the fact that they do a lot of different things. And many of them, it's a little, I agree with Susan's, it's what's confusing is, well, how many of these things are they doing are the ordinary sorts of things that people do when they do counseling versus the things that people do when they have peer assist workers and activities in the community that involve people in ways that are somewhat non-traditional. And so it's a little bit hard to track all that. So maybe a little better. Actually, what I would love to see, if we're going to get something, is more of a narrative rather than a listing. I wouldn't mind reading a couple of paragraphs that said, this is what we do, this is how we do it, this is how many are getting this sort of help and that sort of help. You know, I'm a fan of narrative descriptions of things. So I could say that more generally about what we get from people here, but it's quite difficult to create a narrative out of this overwhelming list, really. But I'm not criticizing the program. It's just the way we report things.
Yeah.
It could be that this is a function of our need to summarize very long applications. I don't have the application open in front of me, but there might be greater detail there. One thing that I can tell you is those agencies give us reports every quarter in which there is room to do a narrative like what you're asking for. So we could just ask for that and then share that information with you.
That'll-
Great.
That would be helpful. Yeah, thanks.
Okay.
Thank you. Any questions or comments? Okay. Well, move on to the next one. And that would be East Central Illinois Mutual Assistance Center.
So I'm the primary for this one. This is a program that is requesting $62,000, and they provide clients with assistance in public benefits counseling, applications for, for, I'm guessing, for their immigration, case management. They help them navigate basically many aspects of life in the US. Their goal is to have their clients become self-sufficient and hopefully develop a support system in the community. They link them to mental health needs and translational services and mental health providers. They try to give attention, especially to families at highest risk for mental health problems, like newly arrived immigrants, refugees, people who have fled like violence and war, people that have been abused or had who were tortured or had history of violence exposure to them. They try to target families that have had a lack of family support or community support, identified by schools, for children that have special needs, or unaccompanied minors, elderly, illiterate people that relocated. And then they target leaders, help of the community, and identify potential leaders for development for volunteer mutual assistance efforts. The program has two staff members that have bachelor's degrees in social work and one with a master's in social work. They serve as advocates, interpreters for parents dealing with school issues like discipline, classroom expectations, bullying, special needs, behavior problems. Tutors are bilingual student volunteers from U of I. They have certified medical interpreters that assist at medical appointments and court appearances. They collaborate with Courage Connection and Trafficking Victims Assistance Program to help serve victims of human trafficking. They have a newcomer immigrant support program that provides the tutoring, enrichment activities, workshops to help children through K-8 to adjust to the new culture and the expected rules and expectations here. They're a designated Illinois Welcoming Center, providing one-stop wraparound case management services. They collaborate with the New American Welcoming Center and La Linea. They also provide COVID vaccine education. They accommodate 10 different languages in-house, plus a variety of others by appointment. Most clients don't call, they just show up, and their ability to provide these services on the spot is very needed. Most of the services during the pandemic have been through telephone. They have an executive director that's an attorney with immigration law training. And then again, they're present in a lot of places, including schools, workshops, resource fairs. So they get out into the community. They're located at the public health department, which has helped, for access. And they also serve, a large Guatemalan population at Central High School. There was a lot of information in the application. A lot of the funding goes to paying for bilingual counselors, of which there are many that are needed. They do a lot of advocacy for immigrant and refugee families. And overall, I feel like this is a great program. And I feel like it utilizes the resources very well. Only 14% of the total funds come from the mental health board, a decrease from 18% previously. So I think they're doing a good job at getting revenue from other areas. which I applaud them for doing. The only thing was the audit findings. They said there was deficiencies in internal control. I'm not sure what that means. I don't know if Lynn could elaborate on what that is, or is that anything that's pertinent?
I'm sorry, I had, someone was trying to tell me someone else needed to get into the meeting, but they already are in the meeting. So what was the
Oh,
question?
on page 110, it says there's some significant deficiencies in the agency's internal control. I'm not sure what that's specific.
Oh, you know what? This was, I'm so glad you mentioned that. And Lisa Wilson, the most patient person in the world, is here. This was not a mistake in the staff summary, but it was actually a mistake in the audit. And is it okay to let the director tell?
Yeah, that'd be fine. Yeah,
Go ahead, do tell, please.
When we received the summary, I was reading through the summary and I noticed the findings from the auditor, and I just froze in my tracks because it was a mistake. I immediately contacted our auditor, who was confirmed that it was a mistake, and while the audit itself remained the same, this was his cover letter, and the thing that made the difference was the 3-letter word "not." There were not sufficient, significant findings or deficiencies. So that one 3-letter word made a huge difference in the cover letter. So I immediately brought that to Lynn's attention. I said, I'm sure this is a mistake. She graciously accepted the corrected letter and posted it. So thank you.
Yeah, thank you.
That's great to hear. I mean,
Thanks for clearing that up.
This is definitely an excellent program. So I mean, I have no critique of this. So I think this is very well resourced. They've expanded their, where they get their revenue from. They provide a lot of services for the community, for a lot of underserved populations and a lot of hard to reach people in the community. So I think it's very well organized program, and I think it's a good use of our tax dollars.
Yeah. Yes.
The only thing that I would add is I think that they should be considered for a 2-year award, because I agree with everything John said. And they have been, particularly given that there was no problem with the audit, there's no reason for them to go through an annual review if we can give them 2 years of funding.
Yeah, and they've been consistent.
Yes, they have.
It's been very consistent. And in providing some of the really small language groups, like I think you guys have a Mayan, someone who speaks one of those dialects in Central America that very few people speak. So
we actually, just to be fair, we actually do not. I think a lot of people are using the same one person in the area who speaks Cajobal, but we do not have anybody on our staff right now that speaks Cajobal. We have been able to, for the most part, get along with enough people who know a little bit of Spanish and Cajobal, and then our bilingual interpreters who know Spanish. I do have to say that COVID really changed the way we had to deliver services. Interpretation and translation is really difficult remotely. We are now open to clients by appointment, because sometimes you just need to have somebody in front of you to be able to express themselves and to really be able to understand what they're trying to say and get it right.
Yeah, and I mean, and I think culturally also the whole idea of trying to talk through a screen is not something many people from around the world want to do. I mean, I grew up in Nigeria and still find it very difficult to do. I'm doing it right now.
I was gonna say, don't feel bad. Even Carl doesn't have a Cajobal interpreter. It's
Okay.
really difficult to find someone.
Yes, I think there's only one in town that I thought he was part of your program.
I think there's only like 100,000 people that speak that language in the world. So it's a very rare language.
Yeah.
And it's remarkable how many of them are right here in Champaign, Urbana.
Yes.
Yes. Yes. Thank you very much. Thank you.
Thank you.
The next one would be the family service counseling. I think Jane Sprandel is the primary and I am the secondary.
All right. So we are all pretty familiar with family services of Champaign County. This grant application is for their counseling program This is the one that like priority is given to those referred to the drug courts. So that is for the actual person going to a drug court and obviously their family, their partners, things like that. So everyone through that program is going to have at least one assessment done. And then their families also, you know, some of these clients are using this service one time, sometimes it's an ongoing service. As we obviously know, usually when someone has hit drug court, it has affected everyone around them, whether it be their parents, their children, their spouse, whatever. So they're only looking for $30,000 for this program. It is something we have done in the past. As we know, in case it's a surprise, the COVID pandemic has caused them to do a lot of telehealth. But I'm glad it was something they were able to continue because this is a very important thing. I think drug court just celebrated some successes of people who just graduated drug court, I think in the last week or so. You know, their therapists do a lot of coordination of services, which is very important, that we're just not saying, hey, congratulations, good luck, buddy. We're giving them an option for some coordinated services towards the future. You know, really, let's see, last year, right now they're anticipating about 70 participants for this coming year. You know, obviously it was down a little bit last year because of, you know, the COVID restrictions. I personally think because this is a program we've seen come through, it's from an agency that seems to take care of, you know, any questions we have. I would be willing to look at a 2-year term for this grant. Yeah, and I guess I would hope that maybe they could do more of the telehealth going forward, because maybe that is something people would feel more comfortable with if they weren't interested in on a one-on-one therapy session, because there is a lot of stigma that goes with therapy, as we all know. So, take it away, Joe.
Yeah, it would be great if they could do more telehealth, but I mean, I think also with some like drug court, a lot of times it doesn't seem to translate as easily on virtually. So it's something that made a multifaceted way in which it provides services might be thing to look at. And yes, I do agree that doing a 2-year grant would be a way to mitigate some of the inconsistencies that might occur with funding. I don't have anything else to add. But
Actually, I have one question.
Go ahead.
I see on page 113 that the ethnicity was 100% of Hispanic or Latino origin. Have they had any Spanish-speaking participants in the past? Is there any issue reaching out to people that are non-English speaking?
Is there someone from Family Service who can answer that question?
Yes. Yeah. Hi, I'm Cheryl Bouch. I'm the Executive Director from Family Service. We have occasionally in the past had Hispanic Latino clients. We're a relatively small program. We've got the 2 therapists, neither of whom are Spanish speaking. Obviously we can arrange for translators, but therapy in particular is really challenging, of course, with translation. So we certainly do everything we can in terms of publicizing the program, of course, with limited resources, but serving that population in particular, again, is challenging without having someone on the small staff who can speak it fluently.
Okay, thank you.
Thank you.
Any other questions or comments? Okay, thank you. So we'll go to the next one, which would be the Self-Help Center. With,
Okay, I think that's me.
you, Julian.
The Self-Help Center has been around for a long time, run through Family Services. They've done a very good job over a number of years. And actually, I believe, provide a pretty unique service for a relatively inexpensive cost. What we're paying for is essentially personnel, and what they do is that they provide information, connect people, help people who want to start self-help groups. A lot of people are interested in, I prefer to call it mutual help, but it's the same idea. It's the idea is people getting together with a common problem and finding out a way to help one another without necessarily relying on professionals. So it tends to be a very efficient, low-cost service. And it can be very flexible, and that self-help groups can start for a while, run and satisfy a need for people, and then other ones can form, or sometimes the same group runs for a long time, sometimes for a short time. But they've done a lot. This organization, this program has provided a lot of good information for people about self-help groups. They've helped particular leaders when they need assistance with some difficulty they might be having in running a group, since they're all not professionals doing it. And they have in the past, I'm not sure about the current, what they're doing now in the pandemic times, but in the past they ran some excellent conferences, brought together people, brought in people from other locations as well, and shared information. And so it's been a generally good thing, I think, for the community. And again, I cannot speak to the current relationships, but I know from the past that if there are professionals in the community who wish and think it's appropriate for their clientele to connect with these kinds of services, they're quite good at being accessible and available. In fact, they welcome professionals who want to refer people and engage with them. So I think they're asking for simply if there is a change in the amount they're asking for, it's pretty trivial. I can't quite recall if it's a change or not. It's essentially the same amount of low-cost service that does good things for the community. So that's what I have to say.
Okay, thank you.
Actually, they're asking for about $500 less, Julian. Excellent summary, pretty straightforward program. I definitely think this is another one that we could offer a 2-year opportunity to. Staff did recommend that we add an additional $500 for the second year, since they do that biannual conference that Julian was referring to. So again, I think excellent resource. It sounds like they also get out in the community to share that it's available and let other people who are serving our community know, hey, this is another option that people can use pretty much free of charge. So.
Any questions about the self-help center? I think it does an excellent job with working with the community, using the resources within the community.
If I could just respond briefly to Dr. Rappaport's question about whether or not we're still doing workshops and conferences in the pandemic. We're trying. We did a workshop in the fall remotely. None of us have great tech experience, but we managed to pull that one off. And we've, again, this is the year we would normally do our big spring conference. So instead we're doing a small virtual conference, but we will have 3 speakers, and that's scheduled to take place in June. We're going to start publicizing that very soon. So it certainly looks different than it has, but we're still really excited to be bringing some great expertise. We're also at the spring conference going to be having sort of a forum featuring 10 different support groups, just the opportunity for each of them to talk about their group and the work that they're doing, and a chance for them to publicize that as well.
Thank you for that information. That's a great example of the kind of thing that I've known them to do in the past, which if you're running these groups, it's really wonderful to have an opportunity that somebody sponsors for you to get together and share ideas and so on. So It's a really unique service. So thank you for doing that.
It is a unique service because I've presented at some of your workshops in the past and I've attended, and I got a flyer asking me if I could present also. I can't do it this year. I don't like presenting virtually. The virtual stuff just not my thing. But thank you for doing it. And the next one is still another one of your programs, which is the program for senior counseling and advocacy. I am the primary reader for that. And it's for adults 60 years and older in a domestic setting. One of the things that you've been assessed for needs, anxiety and depression, isolation, grief, and other mental health issues, all are commingled in that you can find in this age group. It's a great, I mean, you're asking for $162,000, but I think it's the services provided are more than, you do more than enough with what you get. It's only 33% of the budget, so it's not the whole budget. So we have, see, the 6-7% of what comes through is from other agencies and other places. Working with with this elderly population, I mean, you're trying to get people who are not, especially with COVID, and who are not very tech savvy, to get resources to them. I mean, I have a mom who's 88 years old, and the iPhone is still a puzzle to her. Texting is a puzzle to her, and so having someone trying to come in and do the work with her or with someone like her is very it's great. It's, I mean, and with what you're asking for, it is very, very, very important because it keeps people in their homes, keeps people living independently. And it looks like also with the rural community, the difficulties in the past, things like potlucks were held, but with COVID, nothing like that is happening. So it's a little bit
much now.
difficult because those kind of supportive environments is really what keeps people healthy, not just physically, but mentally also.
Yeah.
And what you're trying to do is really quite important. I don't have anything to add. Jane, do you have anything you would add to this?
I don't think you said it, but my internet was cutting out a little bit. Also, most of these are 60 or older, but also those with a disability to use this also.
Okay, so your bandwidth is going in and out. So I think what you were talking about is also people with disabilities also are part of it, and
yes,
that's something that it's very valuable to the community at large, and Family Service does more than its share. Any questions?
They sure do. Thank you.
For Cheryl or anybody? Questions or comments? Okay, thank you. So we'll move on to the next one, which would be the Muhammad Area Youth Club.
So this is for the Bulldogs Learning and Succeeding Together. They're asking for $15,000. This is an application that we've had in the past, and they basically provide school program, out of school programs for kids 6 to 16 years old. They serve the Muhammad and Seymour area, and they basically are offering scholarships to about 110 kids out of 500 kids enrolled in their BLAST program. It includes enrichment activities, academic help, other community-based programs. They use facilities at the school because of how many kids they have. They offer about 5-week sessions 4 times throughout the school year. It includes like cooking classes, like dance classes, some like being creative with literacy classes, some science stuff, and some other classes. The only thing I didn't see in there is it would be nice if they had some kind of like mental health class about, either how to deal with stress or anxiety or something like that. I didn't see that written in the application, but I thought that might be something that would be nice to add in there, especially with the pandemic and how many kids have been dealing with added stress this last year. I mean, all of us have, but definitely the increase in anxiety and depression this last year. Their outcome they follow is that the program will increase school attendance that they track with a survey. Although I'm not sure why they can't ask the school district, but I don't know, maybe there's some confidentiality or consent that they have to get from parents probably to get that information. But the school district in the Mahomet area increased funding due to the increase and growth of the program. Other programs in Champaign County do provide similar services like the Don Moyer Boys and Girls Club, but none of them have transportation from like the Mahomet or Seymour area to those programs, and none of them are in the Mahomet or Seymour area. So this is really helpful to rural parts of Champaign County to provide this kind of service. They have written agreements with like the Eastern Illinois Food Bank and other agencies to help coordinate resources such as the facility space, food, and other things they need. They track their success by how many people attend, the retention of how many people continue to use the program, the parent surveys for satisfaction. About 80% feel there was enough variety of courses offered. 60% felt their child was more engaged in school because of the program. And 85% felt their kids made friends in the program, which obviously is good for their mental health. And then space is held for kids in low-income families based on free and reduced lunch guidelines. They have extensive outreach that they target through through teachers, social workers, principals, the program director. And actually, they personally contact all the parents from the summer program that they have to encourage participation during the school year. And then they provide scholarships to kids that have economic needs, that have IEPs, special classroom considerations, and other developmental requirements. They only have 4 kids that fall in the treatment plan as treatment plan clients, but there's 116 that are non-treatment plan clients that are basically just low-income families that don't have like developmental needs or IEPs. But again, all of us suffer mentally if we don't have good support and ways to release stress. And this is a good way to provide that physical activity for improving our mental health, and socialization with peers to improve that mental health. So even though it says only 4 as the treatment plan clients, I feel like all 120 that are non-treatment plan and treatment plan clients really are the target here. So I think it's a great program. One thing I would suggest, I don't know, in our office for kids, I don't know if non-medical professionals can do patient health questionnaires for depression, just like a PHQ-2, which is basically just 2 questions we ask teenagers 13 and up. And those are just, in the last month, have you often felt down, depressed, or hopeless? Or in the last month, have you often lost interest in things you like to do? And if yes, then basically you should go talk to your provider to discuss if you need further evaluation for like mental health resources. And I think that might be something nice if they can do that, because they're actually pushing for children, teenagers to be evaluated every several months to ask these questions, not just at their well checks anymore. So they're pushing for us to ask these multiple times a year and not just once a year. So it'd be nice if this program could do that, since they see a lot of kids and it's just 2 questions. But I mean, it's just a suggestion. They're a great program. So I think that they're excellent. I have no other concerns. I have no concerns. So.
This is Susan. I agree with John. It's a great summary. The school district does a lot of in-kind support, provides transportation for the after-school program. So they have, they're asking for money mainly for the scholarships, and they have a fee for service for the other youth. I see it as really comparable to our support for Urbana Neighborhood Connections and some of the other programs that we fund. So it's long-term, it's been going on for years, and it could probably be in a 2-year contract as well.
Yeah, I agree. I mean, it's been going on quite a while. I mean, I always go back to when it started. That started as an offshoot of the Dunmoy Boys and Girls Club, and transportation was the biggest issue. And several of the kids used to come to the Operation Snowball meeting at that time also, and transportation was the issue to get them back and forth to Muhammad. One of the young men from that program still works at Mapleton Automotives. I see him every time I drop off my car. But they started out as the Don Moyers in Muhammad, and now it's the Bulldog Connection or whatever. So it's Sarah, do you have anything, if you're there, to add to anything that because we don't really have any questions, but with COVID, how have things been going?
Hi guys, yeah, thank you. With COVID, the after school blast programs were totally canceled, but Muhammad did a hybrid learning plan, both semesters, which required half days for elementary students. So there was a big increase in students attending their kids club program. And that was where we are spending our current scholarship money, supporting that, so that kids are in a safe place throughout the day, since they were only in school for a couple hours. And to the question about patient health questions, I think we could do that with our junior high kids, probably not the elementary, but, and that'll be more in the Members Matter application.
Thank you. So, next one of the Members Matters. So Sarah, hold on.
And I'm the primary reviewer for that. This is Susan. So this is another great program. They anticipate serving 150 students. Their targeted group is 15 to 16, but they have for their non-treatment group 150 students who are low SES. I think one of the great things that they do is they have 3 homework checks a week, and they check in with parents. And they have measurable outcomes for the youth that are consistent with the state benchmarks. So the purpose of the program is to support students 6 to 16, and this has, I think, quite a focus on the middle school or junior high school students. It also provides an after-school, normally would provide an after-school program, and it again has full day school break and summer programs for the youth, and they focus on 5 core values, which perhaps the health and the health value might be extended or expanded to the mental health, but it includes also character, education, arts, sports and recreation, and some focus on STEM. It's a great program. It represents their request represents 13% of the total budget. So they obtain funds from other sources. And again, I think, it's the equivalent of programs that we have in Champaign-Urbana that are provided in Muhammad Seymour. So I'd recommend it for a 2-year grant or 2-year award, and would say that it's been an outstanding program.
Yeah, thank you.
I literally have nothing to add. That was, it's excellent,
Okay, so thank you. Then we'll move on to the next one. No questions for Sarah or anything for any additional things? Okay, thank you. Let's move it on to the next one, which would be the RACES.
All right. So this is primarily a education program. They're asking for $63,000, which is exactly what they've asked for in the past. Mainly when we're not battling COVID, they try to get into as many schools, public events, you know, outdoor settings that they can, just to educate folks about pretty much sexual violence prevention education. Obviously, there's special attention to, you know, some of the underrepresented groups, rural residents. Another big community they target is the LGBTQ plus community. You know, obviously we all know that sexual violence in our communities is high, unfortunately. So hopefully if we can work with our school age students and things like that, we can help reduce those numbers and know that there is assistance out there if they should need it. Their programs are free to all schools and community education, or excuse me, organizations. I believe, and this is a change, if I'm correct, from like their previous like application. I think they kind of had a different target the last time. So yeah, so that's what I've got so far.
Do you have anything to add, Kyle?
Not really. You know, I think it's a really, it's the organization obviously we're familiar with. I think they serve a really important purpose. I mean, to my knowledge, they're the only group in town that's focused specifically on this issue, and it is a very really crucial issue that requires a lot of expertise and competency. So, you know, I'm glad to, you know, continue to support this.
Thank you. Does anyone see anything that you would like clarification about? I mean, I know during COVID, it's made it a little bit more difficult. Is there someone from Races that could answer any questions about how services have been since most schools, there were no in-person meetings? How, if there have been Zoom related meetings, how has it gone?
My name is Jason Greenley. I'm the Associate Director for Races, and Kayla DeCant, who is the coordinator of the program, are both here.
Okay.
And I'm actually happy to say that it's actually been really good. We spent last summer retooling all of our content into online formats. And while it started slow, we actually think we've expanded our reach as far as like raw number of students that we've been able to reach via these new methods. So even once you know, we can go back to schools again, we anticipate actually a pretty significant growth because we'll be able to physically be in schools, but at the same time, you know, be able to do things asynchronously, virtually. So it's actually opened us up quite a bit in some ways. So we're actually really excited to see what happens in the next year as far as how many more folks we can reach.
So there's been a benefit to COVID.
Boy, I hate to use that word, but we were able to pivot really, really well as a result, and we have found some benefits as a result.
Okay. Thank you. Thank you. Anything else? Okay, we'll move on to the next, which would be Rattle the Stars.
Yes, that's mine. Rattle the Stars is asking for $86,500. They're a suicide prevention agency. They are not targeting those who are suicidal, but teaching awareness to the people around them, family members, teachers, you know, people who might come in contact with somebody who is suicidal. And they are they can give workshops to businesses and organizations for a comprehensive suicide response, prevention, intervention, and postvention. And they have revised their program to target also high-risk groups. That was not part precisely of what they were doing. So they've tweaked it some. I have attended one of those workshops in the past, and it has a lot in common with the mental first aid program that Chandra runs in terms of awareness, how to recognize a situation, what to say, how to move someone toward help. And their program was, I know, initially affected by COVID because they were so tied to reaching youth through the schools. So for 2020, they served 62 people and 36 for the first half of 2021. So the numbers are coming up. The main question I have, I mean, it's a program in the past, the board had two questions for them. One, we were funding everything. And we thought, asked that they begin to seek other funding. And so now we are funding 85%. And so they are starting to reach out. The other thing that concerned us was that there was one staff person. And so if something happened to that one staff person, what would happen to the program? They are now listing 4 different positions. So that's good. But I was not able to reconcile in my own mind the expenses and revenue because they are counting $21,500 that we would spend, and yet they're asking for $86,500. Their total budget is $102,000 and change. And if we're doing 85% of that, it doesn't add up for me. And the difference between what they are charging us and what they're asking is $65,000, which is exactly the amount of salaries. So I'm asking, are they charging the salaries to us? And then the other thing about that is, when you look at the budget narrative, there are 4 positions listed, but there are only 3 people listed under personnel. So I just am having trouble with all of that. And I need some answers about how that, there's some mistakes, it looks to me like, in the application.
Okay.
So
Thank you, Elaine.
Yeah.
And
Somebody else reviewed this too.
No,
Was
it
that
was
you,
Jane.
Joe?
It was Jane. I agree. I was a little confused with that. And so that would be one of the questions I would ask. Doesn't have to be tonight, but maybe a little bit of a cleaned up version of that, because the numbers seemed a little off, and I'm sure it's just a slight error. And then another question I had was, obviously, since they can't be in the schools and the community, what have they been doing during this COVID time to still reach out, possibly train people? Are they still doing some online training? I was just curious of that also.
So I don't know if we have someone from Rattle the Stars, and I would also be interested in the answer to your second question, but I'm really confident that the answer to the first question is they made a mistake in the personnel form. And this is why, we've got a lot of errors in financial forms this year. Some of them are actually errors that were made a year or two ago, oh, Kim Bryan is here. And then those mistakes were never fixed. And so when we clone the applications into the future, here come the mistakes again. It makes it very hard to figure out what the request is really for. But I really think it's just one error in the personnel form. But Kim Bryan is here.
I agree.
Okay, go ahead, Kim.
Yeah, thank you, Lynn. So after I received the email with this information that there was some sort of problem in our form, I have not had time to log in and look at that. I was actually at our national suicidology conference over the last week. So I plan to do that at some point at the end of this week, but I'm sure that it is an error somewhere in the form. And I will take a look at that and fix that. To the second question about what we've been doing during COVID. I'm a little jealous of Races and how well they've done with their program. But of course, talking about suicide is a very different thing. And so we made the conscious decision not to do youth trainings on Zoom or in the online format. And the reason for that is because we very often, when we go into spaces and we're talking to youth about suicide, that can be triggering for kids who have experience with this. And it is almost guaranteed we're going to have someone who needs some sort of emotional support or intervention at that point. That is very difficult for us to monitor on Zoom. The concern that we have is because, we are responsible for that emotional safety of the youth that we're presenting to. And we can't do that very well in an online format. If a kid, shuts off their camera, if they exit the Zoom room, we have no ability to know whether that child is okay, right? And so for that reason, we had made that decision not to. We are still doing adult trainings, and we are doing those on Zoom. Initially, at the beginning of the pandemic, we were doing really well with those and had a lot of people attending. As things went on, we've gotten more feedback that people are just tired of online trainings. And we get a lot that, when you're back in person, we'd love to come to this in person. So our attendance at those online trainings has declined. So we're still doing them with smaller numbers. One of the things that really changed for us with the pandemic is we had a lot more requests from student groups at the university. So we've been doing a lot of trainings on campus for university student groups over the last couple months. So that's a population that has really increased. Other than that, because we haven't been able to get into schools and do much work with students, we have been doing other work and trying to connect with schools in other ways, make sure that they have resources and information that they need. We have done, flyers that we've given out to them. We are doing a collaboration with Unit 4 right now. On an initiative that's specifically targeting suicide in Black girls. We've done videos, little video clips that we've sent to schools for them to show students. And we're currently working on a suicide prevention toolkit that will go out to all of the area schools at the end of August, before Suicide Prevention Month in September. So hopefully we can get that out early enough before school starts so they'll have time to review that and start looking at some of the things they may be able to implement in their schools from that toolkit. So those are the things that we're continuing to do. And as far as with the application expanding to larger population, that is really just because, before we were primarily focused on youth suicide prevention, but because there aren't a lot of, agencies that are specifically providing suicide prevention trainings and resources and information to other groups, we'd like to be able to open that up and expand to adult populations as well. We've already done a lot of work with Uniting Pride with the LGBTQ population, but veterans are another high risk group in our area. And so we'd like to be able to expand and include some more targeted prevention for adult populations as well, rather than just focusing on youth prevention.
Thank you. Any other questions or comments?
Thank you, Kim.
Okay. And next would be Rosecrans Fresh Start. Valencia's primary, I'm secondary.
Yes, Fresh Start is one of the old priorities from the justice continuum that we have been funding for quite a while. They're asking for 85,409, and this is specifically for people who have pretty serious involvement with gun violence and the justice system. And the application makes the point that many of the participants learn about this program from their parole officer. So it offers, and they are referred from the justice system, or they can actually, I think, refer themselves. But it's a program that was developed in another city and is spread nationally, where there's a call in, and it's a fairly small group. In the years that this has been in this community, I think it has been from maybe 11 to 19 people, with kind of 15 as the average. And there's a very formal call in where the people that have been offered this service are go down to the Illinois terminal, and there are a number of speakers that essentially from the police, from the community. There are people speaking whose families have been impacted by gun violence. And they're given, this is not a sentence, it's a choice. They're offered participation, and shown all the resources that will be given to support these people if they will make a fresh start away from the criminal behavior that they have been indulging in. And so the statistics are, the hope is that 50% of the people who are offered this choice will take the choice. If they don't take it, then they're pretty much going to be noticed. They're on notice, really. And just the other day, there was a crime report in the paper of somebody who had been arrested, who had committed a violent crime with a gun. And the reporter noted that this person had been offered Fresh Start and had turned it down. Now so the hope is that 50% of the people who are offered it will accept that challenge. And here, 30% stay through the whole program. Nationally, it's only 20%. So we're doing better, I guess. It's and this was a community coalition program, and so we fund the staffing of this through Rosecrans. It's a very necessary. It seems like a small number of people, but it's a tough thing to accomplish. It's just a really tough for everybody. I'm sure the people who help, the people who make this decision to change their lives, and I think it's one of the core programs of our justice continuum. So,
and as a secondary reviewer, I mean, one of the things that I think about is because it is so much of a restorative approach to justice, because I think too many times we look to punishment first rather than looking at how do you restore this individual person to the community. And this is one of those ways that we're trying to move the pendulum in that direction rather than just going to the punishment route. Mm-hmm. And so Fresh Start gives people a chance and an opportunity to see that there are victims, and they are victims also, and they're victims on this trauma continuum. And how do you restore yourself to the community so that you can be part of a larger solution rather than being the problem? And for what they're asking, it's small. Go ahead.
Well, I should have said also that it has been discovered that and obvious, I guess, that a lot of the people who are brought to this program have mental health issues, substance abuse issues. That's why Rosecrans is the provider, is the coordinator of all of this. And there also has been added, I think, another way of entering the program, which is a one-on-one rather than the call-in. I understand. I'm not quite sure how that works, but so there's more than one path now. Yeah.
Yeah. I mean, I think it's an important program, and I think we've got to keep, instead of just looking at the individual, start looking at the community around this person and around the issue rather than just that individual. It is a community solution rather than just an individual action. Is there someone from Rosecrans that can speak to how this is going with COVID as it right now?
Sure. I'm Gail Rainey. I'm the administrator at Rosecrans. That we have not stopped these services at all during COVID. One of the things that did change slightly was we used to provide some of the participants a lot of transportation, and in the midst of COVID, we backed off of that. We have started to resume that again. But it's an intensive case. The piece of the program that we do is the intensive case management for the participants. And it's a large collaborative with the coalition, but also there's a steering committee, and the steering committee actually chose this just recently. So since the application was submitted in February, the steering committee has expanded it to the entire county. And so now we're starting to get more referrals from some of the outlying areas as well. So we anticipate transportation needs increasing even more with some of that as well. But like I said, we've continued to meet with the individuals one-on-one during COVID and continued to provide those case management services.
Thank you, Gail. Any other questions and comments?
I did have one question. Correct me if I'm wrong, Lynn. Didn't this program have funding also through the Champaign City Council in the past?
It's a part of a bigger project. This piece, the piece the Mental Health Board has been funding since the beginning, is the case management I described. But the city of Champaign had received a grant through ICEJA, which is Illinois Justice Information Council or something like that, to do some community needs assessment and then to do a survey around the effectiveness of the program. And then I'm not sure if they had funding for other pieces of it. So the city of Champaign talks about the Fresh Start Initiative, and it's a bigger set of things than this. This is the foremost.
So does the city of Champaign actually fund some parts of Fresh Start Initiative then, or?
But they might, but not this. But it looks like Gail is ready to answer.
It's a great question, John, because it is confusing to people. So the way I explain it to people, maybe this will help. It's like a 3-pronged stool, and one of the prongs is the community at large. The other prong is the case management and community interaction to try to help the participants get into other or connected with other resources. And then the third prong is the law enforcement and criminal justice piece of it. So by no means is Rosecrans all 3 of those stools, or pieces of the stool, I guess I should say. But what the city of Champaign did get funding for, and the funding has since gone away, ICJIA did initially fund the pieces that Lynn talked about, and also what was called a program coordinator. And that person was able to help with the coalition piece of it, plus bringing all the components together, a lot of the communication amongst all of the different parts. And so there are still some of those pieces left, but ICJIA is no longer funding it. And the city of Champaign does have some funding that it's pieces of some of their staff members that they're using to help continue to coordinate. So I hope that helps.
Yeah, it's just good to know. I knew in the past, I thought they were funding some of it. I just didn't know what. That's why I just wondering, since it said we're funding 100% of the revenue. I was just wondering what they were funding or had been funding, or if they are still funding it. So thank you for answering all my questions.
Thank you. Okay, the next one would be prevention. That would be me. Prevention, myself and Mr. Patterson. So the prevention services would be substance use disorder, and for system of care for children, youth, and families. The target population is mainly youth, young people within the community, and from requests from school personnel or from existing relationships, the parents, and also the community at large. And I think one of the things that I think with prevention, I see that the youth is more of a symptom to a larger issue, that the child is not just the main problem per se, that there is something tied into the larger family system or social environment. So to me, prevention is not just preventing the young person from using substances, but try to get into the community to make sure that the community is aware of the services around. The work with both Champaign and Urbana schools and trying to get into sort of the rural districts with prevention, but also with what's going on now. From working in prevention over the years, it used to be very hands-on, one-on-one, or one to community or whatever. How is it going right now? That's my biggest question. I mean, I see that there were some things that have been tried, but what else is going on to prevent, for prevention, as we're seeing that the opioid deaths are going up, I mean, nationally. What are we doing here locally? So that's some of the questions that I have. I don't have anything else. Kyle, do you want to have anything to add?
No, that's pretty much it.
Okay, no problem. So Gail, what's going on with prevention, if you're the one to answer the questions for all of Rosecrans?
Yeah, it just so happens all of these programs do fall under my supervision. But so yeah, with the prevention program, we've actually increased our services this year during COVID. Again, going back to being able to turn on a dime, our staff were able to go virtual with the evidence-based program that's Too Good for Drugs. And so the numbers, there was a question about the quarterly numbers that someone asked if they were lower than in previous years. It has to do with how the quarters of the fiscal year don't line up with the quarters of the school year. So actually, at the end of this quarterly report that we're submitting right now for the third quarter, it will actually show that we've exceeded some of our numbers thus far. The other piece that we've been able to do even during COVID is just prior to COVID, we had gotten the most number of schools in Champaign County than we ever had success before in registering for the Illinois Youth Survey, which would help answer some of your questions, Joe, about the long-term pieces of what we're doing. Unfortunately, the Illinois Youth Survey is done only 2 years, every 2 years. And last year was the year it was supposed to be done in March and April of last year.
Oh, okay. We know what happened
So,
then.
so there was not a lot of participation, needless to say, by the schools. And so we are looking forward to re-engaging them because the next cycle comes up next school year. And we've had a lot of luck in getting more to at least agree to participate. So we're looking forward to finally having a little bit longer term data. Obviously, a longitudinal study of what's happening from a person in, let's say, 5th and 6th grade all the way until they're 25 years old would be pretty expensive to do. And so that hasn't been done. We even asked the people that put together and have done the research on Too Good for Drugs if they had any historical data, and they haven't ever had enough money either to do a long-term longitudinal study like that.
So is there any way you could ask those people to change their names Too Good for Drugs? It kind of bothers me. It's personal.
Yeah, I think that, so the name of the program goes back to that it's about helping the kids learn how to make positive choices. It's a lot about decision-making skills and life skills. So it's more about that piece of it and helping to build the self-esteem. But I understand exactly where you're coming from.
Yeah, well, it just really resonates of the 80s of just say no. Okay, let's move on to.
I did have a question though.
Go ahead.
How is that portion different from, like, say, the DARE program?
I wasn't going to bring that up, John.
Well, the reason why I wanted to bring that up is because the DARE program wasn't effective. Not effective. So I just want to know why this is different.
Yes. So the way that it's different from DARE in many ways, actually, because it continues. We go back to the same schools year after year after year and work with the same kids year after year after year. And there are often times where we're following the same youth from 5th and 6th grade all the way through high school. And we're seeing better outcomes that way. DARE was a one and done type of situation where they'd come in for a couple of sessions, usually in 5th grade. And there wasn't the ongoing support that we continue to offer with this program. And it's not just like the Rosecrans piece, it's the model itself that is different.
Okay.
That's good to know. Thanks.
Thank you.
Can I ask a question about that?
Yeah, go ahead, Julian.
If you're following the same kids over multiple years, then I'm guessing you would have information on how many of those kids are not involved in what you're trying to prevent and how many are. I mean, that seems like it would be just right there in your hands.
Well, we do the pre and post test of their knowledge
I don't mean that kind of information.
Right,
The kind
exactly.
that talks about their actual engagement.
Correct. And that's the kind of information that does come in the Illinois Youth Survey. So we would have that.
So what I'm
if it
confused
had been
about,
done.
I don't want to give you a hard time here. I just
It's
want
okay.
to undo my confusion.
Sure.
If what you just said was you're following the same kids over time, well, that means you're talking to them.
Right.
So you would be getting information, presumably from observation and conversation about their engagement with drugs. So why wouldn't you just keep track of that? You don't have to report them individually, but wouldn't it make sense to just keep track and sum them up?
So we're following the same classes of students, but that may not be the same exact individuals every year.
Okay, so the reason I'm asking
it.
this question is because as far as I know, and maybe I just don't know because I am not totally focused on this problem, but from what I have understood more generally is that programs like this, education for drug prevention, tend to have a pretty unconvincing record for actually accomplishing drug prevention. So I'm looking for something to convince me that this is not like that this is different, that I have better reason to think that we're not just that, maybe, that we should use our money for this kind of program as opposed to some other thing you might do. It just kind of confuses me that because of what unless there's something totally exceptional here, our national ability to prevent drug use through these kind of educational programs that get kids to say the right thing when you ask them doesn't seem to be extremely effective in the real world of children and drug use. So I want you to convince me somehow that this is different than that.
Well, I think you could look to some of it's similar to some of the healthcare models as well, where how do you show that uh, people's eating habits and things like that have changed due to prevention. It's a similar model to that. We're reaching a lot of kids that we wouldn't reach otherwise. And it's a lot cheaper, quite frankly, to do prevention than it is to do treatment. Some of the national information that's out there is we're saving a difference of $1 spent in prevention saves
I don't have to be convinced
the
about the
$18.
value of prevention. What I'm
Right.
asking about is the method for accomplishing it.
I mean, I don't know if that could be answered right now, and we still have several other things to review.
I won't continue to pursue it. Thank you.
Okay, no, but it's something to keep in mind because I've worked in prevention for many years also. It's always one of the questions that was asked of us when I did prevention, and it's going to be an ongoing question to ask. How is this program actually meeting the goals of what it's saying it's supposed to do? And that's going to be a constant question we would ask you, and we would ask of programs similar to this. Thank you. So the next one would be specialty court, and that would be Patterson and Valencia.
All right. Yeah, specialty courts. It's Rosecrans again. This is drug court. This is for adults who are involved in the justice system and referred through the courts. I think it's a program that's been around for quite a while. I think we're all pretty familiar with it. Yeah, I mean, I don't know as far as what to add. It seems like they are keeping a pretty similar pace as far as previous years when it comes to clients served. Not sure if there's really substantive changes with the judge change for drug court about a year ago. Judge Ford, who's been doing it, I believe, since the creation, retired. And I believe Judge Rosenbaum is taking over in that role. But yeah, yeah, I'm not sure if I have much else to add. It's like I said, it's something we're pretty familiar with. This also, I guess, something of note, and I feel like this is deja vu because we saw this earlier. The request is for less than last year, but it looks like we are now the sole funder, which I don't fully understand how that works out, but okay.
Okay. Anything else to add?
I'm the second reviewer, and this is a conversation for another time perhaps, but I track a drug court program in Eastern Kentucky, where I'm from, which sentences some drug, you can choose to be sentenced to do art. And it's I know I've talked to Stephanie about this program, but I wonder, about giving people options like that through this. The thing that the people who do this in Eastern Kentucky say, because they are making guitars from scratch, starting with the wood in the forest. You know, they're making quilts by hand, not with a sewing machine. And they talk about how they have learned patience and you know, delayed gratification, so on. I just wish we had a program like this here. I've mentioned it before. It's called the culture of recovery. And to not only, you know, monitor and counsel and all of that, but give people things to do that they learn life skills, but they also, you know, learn more than that in terms of who they, what they want to do with life. So I won't say any more about it, except it's a program worth studying. And they have community people who are expert in these different fields who teach them wood carving, you know, that kind of thing. You can't do that quickly. And so you have to learn to slow down and pay attention and so on.
Well, thank you very much. Thank you. So let's moving on to the next one. It's the Terrapin Station sober living, and that would be me. It's a new program. It's a new request. So it's innovative practice, access to behavioral health. The target population are individuals with substance abuse disorders, mental health, physical disabilities, and homelessness, and who are in need of structured sober recovery. And it's a step down from a residential treatment facility. The military are transitioning from criminal justice. So it has a pretty heavy load that it's looking to shoulder here. And since it's a new program, success, we don't know about how successful it will be, but I think the more programs we have like this would be beneficial for the community at large. And what they're asking for isn't an exorbitant fee, but we're looking at it, and the staff wrote that it's designation could use a fund designation for up to 3 years, or at least a 2-year cycle. So it's something to consider as we look at this, because they want to do quite a few things. I mean, they want to do drum circles. I mean, I'm all about drum circles because back in the day I used to do drum circles with folks too. So, but that moving along, it's what I see as something that that is feasible, that we can support, but it's also, the funds are tight, so we can't say everything is going to be funded at that level that they're asking for. I don't have anything to add to it. Mr. Patterson, do you have something to add?
Sure. I just want to first say I don't think any of us are surprised that you're a big fan of drum circles, and I mean that in a very good way. For the total program budget, it listed an amount that was less than how much the funding request is.
Mm-hmm. Yeah, I saw that. Yeah, 47 and then 21. Oh, 21 and 47. Yeah. So is there anybody from Terrapin around?
You know, staff maybe had insight.
Well, I don't see the person on the call. I think there's really only one person working on this project locally, at least. I think this is another one that just, there are some big errors in the financial presentation. So, you know, prior to contracting, I think we want to straighten all that stuff out, but I tend to believe organizations, when they're asking for a certain amount, that is the amount they mean, but they maybe just haven't filled out the forms correctly. Like, start there. Maybe there's something deeper too, but I felt the same way about this one. Like, they probably do mean this request. They didn't, I think they didn't do the personnel form correctly also.
Yeah, I mean, and a lot of these small boutique organizations, as I would sometimes, do not have their bookkeeping in order. And so it makes it a little bit more confusing when they try to look at numbers. They have the great ideas, but not the bookkeeping down. any questions or comments maybe
Yeah,
we
I
can
have a
try
question.
to tease
I have a
out?
question, Joe.
Go ahead, Julian.
I'm not, can somebody, maybe Lynn, tell us about is there an organization here that behind this program? This is not just one guy doing a thing, right? It's there's some kind of organization that this is coming from that's asking for support to do it here, or I'm not sure. I couldn't find, maybe I didn't look hard enough, but I don't know who are we giving the money to?
Well, I used the internet to learn extra things that were not in the application. So, you know, the application maybe needs a little bit more detail along those lines. It turns out the board is not local. The person who's running this program is local, but he's on the board. So for the board, for their agency board to be compliant with our own requirements, they need to have a local person, but they can't be the paid staff. So they have to do something to be fully eligible here.
Mm-hmm.
But so you're right, it's a small organization. It's one person here, but there is actually an organization. I think most of them are in the Chicago area. But
Yeah, so size doesn't bother me. I just want to know where the accountability lies and who these folks are and, you know, that sort of thing.
Gotcha, yeah.
Making sure you know there's somebody you can call.
So is it the Terrapin Station Sober Living? Is that what we would Google in?
And it's a really interesting organization. I'm glad I took the time to do that.
No, it totally looks interesting, but of course, you know, when we talked about budget and things like that, we gotta make sure we know exactly what we're funding. I think it's potentially a great program needed in our community. We just need to get all the T's crossed and I's dotted.
I appreciated the creativity that I found when I was looking around online. Enjoy.
Yes. Okay. Not to hurry because I'm in time. It's of essence. So let's move to the next one, which will be the Up Center. Children, youth, and
I was the first reviewer on this one. As we're aware, there is no other county-wide organization that focuses exclusively on the needs of the LGBTQ residents, their families, and all that are, you know, part of their support system. You know, again, we know that they're very important in our community. We're a very, I want to use the word loving. I know that's not always true, but, you know, we embrace folks from all walks of life. And I think that part of that can be thanked to the Up Center. As far as financials, they are looking at this year, $86,603. What is shocking though is that is 172% increase. In the past, we've given them $31,768. So, you know, my opinion, my experiences is yes, they have a lot of fantastic things going on to support folks in our county. But I think we might have to look at, is that request more than we can do at this time? But again, they kind of focus also on the mental health aspect of it, since we know that suicide and things like that are a higher percentage in the LGBTQ community.
yeah, and that's one of the bigger questions. And I think Daria is here, or someone from the Up Center could answer some of the questions. I mean, and also how have they been doing in this time of COVID? I know with some of my students at Parkland, I've recommended you going to using Up Center to get information. And how are they also doing with the rural community, getting the outreach into the rural community? Is there someone that could answer that?
Absolutely, thank you. My name's Courtney Cuthbertson and I'm a board member for Uniting Pride. And first, thank you for reviewing our proposal. We really appreciate the support that we've received from CCMHB. So compared to a year ago, we had Well, I will say first, with this proposal that we've submitted, in the past, we've requested funding solely for the children and youth programs and families as well. And now this proposal is to be inclusive of all of the programming that Uniting Pride offers. A year ago, we had 2 regular programs that were offered, and to be responsive to emerging concerns and needs among the LGBTQ community in the county, we've increased that to 8 regular programs that are now offered. Like most everyone, we've shifted to a lot of online programming due to COVID, which I think has had its advantages and disadvantages. I think that in some ways it's helped to reach people in more rural areas of the county because we don't have transportation issues, although broadband access is a real concern. Daria, would you want to speak any more to programming with more rural areas of the county?
Yeah, hi, I'm Daria. I'm the programming director at Uniting Pride. So for our rural counties, we've currently been getting a lot of asks for help in the outlying counties like Shelbyville and I don't remember the other ones. North, I think it's Iroquois. Thank you. Sorry, I'm from Arizona. And how we respond to that is by sending them to our trainings. Our training committee is currently seeing at least 1 or 2 requests for trainings a week. And those youth that come to our programs, I do invite them to our programs. We use our donor dollars for that because these youth have no supports. But I will mention that one thing that has been a little bit challenging with COVID is that we've been able to increase our outreach for adult programs incredibly. Adults love that we have virtual programs, but it's not very accessible for youth that aren't out to their family. When we were in person, they were able to say, oh, I need to go to the university and get a Starbucks. But you can't really call into an LGBTQ youth group from your phone and not hear your parents and not have your parents hear you. So that's one way that COVID has impacted us. But we've also been able to do groups for adults with disabilities, older adults who couldn't get out. And so that's been amazing.
Thank you very much.
Mm-hmm.
I think Lynn has a question or a comment.
Go ahead, Lynn. I'm sorry.
I just want to share something. I don't think I have done this before, but some of the Uniting Pride board members have been so responsive to us, to staff requests for information, and they have been really heroes this year as far as like, there's just a lot of stuff that we needed to work on with them, and I just want to share that because it feels, they have really, I think, gone out of their way to be available to us. These are volunteer board members like you guys, and they've just made a lot of time for us. So I just thought you should know.
Thank you. Thank you very much. Okay, next will be the Abandoned Neighborhood Connections. Maybe Patterson and Rappaport.
All right, the Urbana Neighborhood Connection Center. This is another agency I think we're all very familiar with. This is a program we funded for a while. I think the one thing that was a little confusing was it lists the hours of services that they're providing, some all day, some after school services. But it says
races is Jason.
Oh, go ahead.
The following reflects pre-COVID-19 operations and will return to full capacity once restrictions are lifted. But then the staff comment is revised.
Liz, hello.
Revised with regard to changes in 2020 due to pandemic. Otherwise maintains long.
Hold on, Liz, give me one second. I need to mute my computer.
So my question is, so are the hours listed on here what they're going to currently be doing, or is this stuff that's got to go back once the COVID restrictions are lifted?
This is Janice Mitchell, and I am on. Hi, if you'd like for me to answer.
Yes, please, go ahead.
Okay, actually, Urbana Connection Center, as you know, we were after school and then summer. However, when kind of the stay-at-home hit back in March of last year, we actually closed down pretty much for about 2-3 weeks, just enough to reorganize. We were on Zoom and I think I provided mental health board with a report, but we only had Zoom from about April 1st through June. And ever since the 1st of July, the first week in July of last year, we have been totally in person, 7:30 to 5:30, Monday through Friday. And we, even though summer's coming up, it usually say we're transitioning into summer. We will still continue 7:30 to 5:30 as we've been since last July. So we are currently 5 days a week, 4 days.
Well, that's, thanks, Janice. I mean, I don't know how you guys do it, but you're still doing it. So, Julian, do you have anything to add to it?
Just two brief comments. One is, this is a program that's been doing good work for a long time with people who are really respected in the community. And the second thing I would say is, as far as I can tell, we're only supporting 13% of their total budget. So it looks like they got a lot of support from a lot of places. So I'm happy that we're a part of it.
Thank you.
Yeah, here. You're working too hard, Janice. I don't know about that.
Well, many thanks to the mental health board, because without the support, and again, we all know what we're facing right now in the midst of in our community. A lot of, even though it's not presented in our actual request here, we are dealing with reality, realistic, day-to-day lived experiences of some of our youth whose families are and who are having to, what I want to say, we're helping them to survive what is going on as a result of some of the violence. And although it came up after our requests were submitted, we are multifaceted in terms of non-traditionally making certain that our kids have what it helps from day to day. So thanks to the board.
Thank you. Thank you very much, Janice. Okay. Any other comments about Urbana Connection? Okay, the last one. It's a new program, Win Recovery, and that would be Patterson and me.
This is a new request. I believe this, they've been operating for maybe a little over a year now. But yeah, this is a reentry and recovery home. Looks like they're providing, targeted towards women and LGBTQ individuals who are dealing with substance use and reentering the community from the justice system. I mean, I think this is, sounds like a great program. Looks like they're going to be doing case management and, connecting their clients to resources. Also looks like they're getting a lot of funding elsewhere, which is always good. Yeah.
I waited for dessert with you.
I know if, yeah, that's pretty much all I have. I mean, it seems pretty cool. I don't really have any critiques.
Okay. I mean, as a second reviewer, I think the fact that we're looking at the crisis and response to making sure that when there has been a crisis that we respond adequately, and that's what this is all about. And they're looking at other areas to find resources, so we're not the sole sponsors of this whole endeavor. Is there someone from Win Recovery in the?
Yes, I'm Bethany Little. I'm the founder, executive director of Win Recovery.
Okay. So tell us what we don't see.
I get that a lot.
in 1 minute, just
in 1 minute. Okay, I don't know how I can do that, but
2 minutes.
Our population that we focus on are women and the LGBTQ 2S+ population. We focus on individuals that are co-occurring diagnosis, coming out of prison, treatment centers, our jail. We serve as an alternative to prison. When they come into our program, they do a 12-step, they participate in recovery and they do 12-step programming. They have case management, as well as we make sure that they are connected to all of the other organizations and agencies that they need to be able to be successful on their own as they rebuild their life. We also do trauma peer facilitated groups. We do parenting and we do personal finance. There's 3 phases to our program, and currently we have 2 homes. The second phase is after they get some stability emotionally and mentally here in employment. Here at the first house, they go to our second phase, which we have a partnership with the Housing Authority of Champaign County. It's an independent living, so they don't have policing or anything over there. They're able to stand on their own, but if they fall, we're there to help. And so after they complete that particular part of the phase, which lasts about 3 months long, and they finish our program, then the Housing Authority gives them a voucher to go out in the private to go and choose a home of their own. They still participate with WIN recovery, and so therefore, if they need any services or anything of that sort, we are pretty much a lifetime. Once you participate, you're stuck with us.
Okay.
So.
Sounds good. Thank you very much for giving us that quick snippet of what you do. We've come to the end of the review process for today. I think we have. Yeah. And until next month, I mean, is there?
Lynn has some comments.
Oh, go ahead, Lynn.
You have come to the end of the process, but I need to tell you, and I need to say it publicly, that there were 3 applications submitted during that really brief, like additional NOFA period.
Okay.
2 from First Followers, which were to continue the things that are currently funded there, and 1 from a new organization called the Well Experience. And so I may have shared with each board member that those are available on the online system. If you want to look at them and not go into the online system, I can make copies, paper copies of them and get them to you. There won't be time for staff review, but I think most of the staff have looked at them already. We just, putting all of our thoughts together and giving you a program summary is not practical, but we can look at them in between meetings, and then at your next meeting is a study session, and it's just 2 weeks away.
Okay.
Isn't it like May 12th? That's really soon.
Yeah, it's May 12th. So 2
But I
weeks
have to say
exactly.
something to you about all those programs on May 12th. Okay.
Okay. And so we're just going to wrap it up. So what else do we need to do? Just make a motion to adjourn.
So moved.
Oh,
Or seconded or thirded.
Yes, all seconded at every. So do we have to vote on it, or we just go home?
No.
We're home already.
Oh.
Okay.
Great meeting.
Great. Thank you. You guys have a wonderful couple of weeks. We'll see you soon.
Okay.